currently work as a consultant psychiatrist overseeing the care of predominantly university students. And in addition to that, I do some work in liaison psychiatry, providing a service to the dermatology department at the Queen Elizabeth Hospital in Birmingham, and also to the dental hospital, principally to the oral medicine department at the dental hospital, Birmingham. For a period, I was also responsible for providing perinatal psychiatric services to the Birmingham Women's Hospital. I've been a psychiatrist now for well over 40 years. I came into psychiatry in July 1978 and worked in Nigeria for a year before coming to train as a psychiatrist in the United Kingdom, and originally trained in Newcastle before moving down to Birmingham for a consultant post. I continue to practice psychiatry and to enjoy it very much. The incredible privilege to be able to work with people, to pay attention to their needs, to listen attentively, to work with them, to see in what ways one can be helpful to resolve some of the distress and emotional upset that people are experiencing has been an extraordinary privilege. Medical director for my trust for many years until 2001, and before that I was clinical director and organizing tutor for the All Birmingham Rotational Training Scheme. At the college I was chief examiner of the Royal College of Psychiatrists exams from 2002 to 2005, and before that I'd been involved in the college exams since 1989, joining the examination subcommittee and going on to be deputy chief examiner for the Master Psych Part 1, as it was called at that time, and later on as deputy chief examiner for the Master Psych Part 2, as it was called at the time. Within the college, I've worked extensively with the publications department as an editor of the British Journal of Psychiatry, the Bulletin, and the Advances in Psychiatric Treatment. I'm one of the current editors responsible for book reviews, and I also sit on the book committee that commissions books for the college publications. I'm privileged to be awarded the Royal College of Psychiatrists Lifetime Achievement Award in 2016, and in 2019 I received the Honorary Fellowship of the Royal College of Psychiatrists. In my work as a psychiatrist, I continue to be considerably involved in literature. I'm a member of the West Midlands Writing, which oversees the Birmingham Literature Festival, and was in the past also involved in another book festival in the city of Birmingham. I write poetry, and I occasionally go to read my poetry, and I'm involved in a number of I also run, and that has been quite helpful as an outlet to take me away from some of the stresses and strains of practicing psychiatry. As a role in the care and treatment of all individuals who have severe mental illness wherever they may live. And this is as true for individuals who are from the black and ethnic minority communities in the United Kingdom as it is for those who come from the native population. So my own view is that the role of psychiatry in this regard is exactly the same. Of course, there are issues to do with the way in which culture modifies and plays a role in the manner in which people present and in the way in which they interact in the clinical encounter. And it is therefore of extreme importance that clinical psychiatrists should at least be aware of the ways in which culture inflects the ways in which people present within the clinical encounter. During the appointment of individuals onto the training scheme, or indeed to posts as consultant psychiatrists, it is my view that some exploration be made of the individual's flexibility, their awareness of the differences, even though these differences are marginal, but nonetheless they are important between individuals, and that these differences can sometimes be determined by culture and social class, and that psychiatrists ought to be aware of this and be flexible enough to take these into account so that the treatments and the interactions are fair and reasonable. Access to psychiatric services. The services must make itself relatively accessible to all citizens of a country, and the services must be aware of some of the barriers that exist. And these barriers are self-evident. There's a degree of lack of trust, the fear that one might not be treated fairly and justly, the idea that the system, that the psychiatric services, is an oppressive system that must be avoided at all costs, and therefore it's necessary for the services to work hard to ensure that everybody in the country feels that the service will be to their benefit, because otherwise sections of the community will continue to treat the services with a degree of distrust. That it is important that the services, indeed all areas of human endeavour in the United Kingdom and in Europe in general, should be staffed by diverse populations. I'm absolutely sure that if this was true, then the degree of anxiety and distrust that people have about the nature of the services will be markedly lessened. So these issues are as important for psychiatry as they are for the media, as they are for all aspects of human life, as they are for managers in the health services and for people who run the financial services and in all areas of life, including the civil service. And I am, of course, not arguing that you can only be looked after by somebody who looks like you, but nonetheless, you'd expect that there will be a fair representation of people who look like you and who have experiences that are similar to yours, working across the NHS and in particular working within the mental health services. To reduce stigma is an ongoing project. It's a marathon rather than a sprint. So the desire which all of us have to reduce the stigma which attaches to a diagnosis of psychiatric illness or that attaches to the treatments of psychiatric disorders obviously needs to be reduced, because it's only when it is reduced that we will start to see that people would approach psychiatry and mental health services like they might approach the physical health services when they've got diabetes or have heart disease or asthma. So our desire is to ensure that we work very, very hard to ensure that people feel less stigmatized by having a psychiatric disorder. There are all sorts of methods that ought to be used, and one of the most important of these methods is to demonstrate through people who themselves have suffered from psychiatric disorders, by making it plain and public that they have, that nonetheless, even though it can cause periods of anguish and distress, that nonetheless they're managing and they are living their lives as necessary and so on. So this is quite an important aspect, because we all know that recognizing somebody, knowing people who themselves are unashamed by the fact that they've suffered from an illness, helps others to come forward and to readily accept treatment. So the same rule that applies to the wider generation, wider society in this manner, also applies to people from the black and ethnic minority communities.